Myringotomy with grommet insertion. This is the topic. There is a possibility of accumulation of thick fluid, glue-like fluid in the middle ear. This condition is termed as otitis media with effusion. So, this is usually seen in children and it is seen in both the ears. This will result in hearing loss and there will be poor scoring also. In this video, I am concentrating only on the surgical management of otitis media with effusion, that is myringotomy with grommet insertion. So if you want to know the detail about this condition, otitis media with effusion, in YouTube, enter Dr. Zakir Hussain ENT, otitis media with effusion English. You will get everything in detail, starting from introduction, what are the causes for it, the presentation, examination finding, necessary investigations, medical management and surgical management. Here I will concentrate only on the surgical management. As I have mentioned before, the commonest indication for myringotomy and grommet insertion is otitis media with effusion. So before going into the surgical steps, showing the surgery, let me show you a few diagrams. So here, if you see, I am putting an incision. There is an incision in the eardrum, followed by the grommet, positioning of the grommet after sucking out all the glue, and the grommet has to be positioned in the eardrum, and we have to make the opening of the grommet patent also. Now I'll show you a video. In this video, as you see, I'm doing a myringotomy incision first. I'm making the opening wide enough so that I can position the grommet. You can see it's a bloodless field, not even a drop of blood. I'm doing it not with microscope but with an auto endoscope, telescope. So the incision is made wide enough. Then I'll position the grommet right on top in the gap between the incision, and just with slight manipulation I'll position it in the incision. So that is done. It will be in the position. So after that we have to make the grommet opening patent. A mild suctioning will do that. So after this, the patient can be discharged the same day. As you see, the procedure will be over in 5 minutes, less than 5 minutes, in a straightforward case, usually less than 15 minutes for both the ears. This procedure is usually combined with adenodectomy, that is the removal of the grommet. The usual complications are, some patients they may bleed, and after discharge, if there is water entry in the ear, especially during head bath, then it can result in infection. This grommet which you have placed in the tympanic membrane, usually the grommet comes out by itself after 6 to 8 months. So in some patients what happens is, the incision which we have made, even after the grommet which has gone out, the incision doesn't close by itself, and this may result in perforation. So these are the common complications. So in this video, I have concentrated mainly on the surgical management, the different types of what are the different indications, what are the different type of grommets, in detail about complication. If you want, you have to watch the topic otitis media with effusion. Thank you so much.